Hi, and welcome to another anatomy painting video. In this video, we will be looking at the rhomboids. The rhomboids are a muscle that sits deep to the trapezius and is mainly responsible for retraction of the shoulder girdle. The rhomboids are actually a group consisting of two muscles, the rhomboid major, which is the biggest, and the rhomboid minor, which sits superior to the rhomboid major and is actually a bit smaller in its size. You can see on the video I've made a point of separating those two so you get a visual as to the difference between them. Both of these muscles will originate on the spinous processes in the spine and will insert on the medial border of the scapula. The rhomboid minor will originate on the nuchal ligament and the spinous processes of C7 to T1 and will insert on the medial border of the scapula. The rhomboid major will originate from the spinous processes of T2 down to T5 and again will insert on the medial border of the scapula. The rhomboid's primary muscle action is to create retraction at the shoulder girdle. Retraction is sometimes referred to as scapular adduction. However, they have another role, which I would argue is a little bit more important. They will work isometrically. Isometric contractions meaning the muscle generates force and creates no movement. And as they contract isometrically, they will stop us falling into protraction, such as in a deadlift. You'll notice that the muscle runs in kind of a diagonal orientation. Now, this allows the rhomboids to also rotate the scapula somewhat. You see this happen when someone performs a pull-up. As they pull up to the bar and their scapula retracts, it also rotates in towards the spine. And then as they let themselves down, you will see the scapula kind of rotate out again. And this is due to that muscle orientation, those fibers running in that diagonal position with the rhomboids. And there is our showcase for the rhomboids, and you can see them running in that diagonal fashion from the spinous processes down to the medial border of the scapula. And then their primary muscle action, which I'll show in a minute, is retraction of the shoulder girdle. I hope you enjoyed this video, and thanks for watching.